Battered baby syndrome is a form of physical child abuse, also known as a non-accidental injury of childhood, child abuse syndrome, Caffey syndrome, or maltreatment syndrome in children. A battered child is one who has received repetitive physical injury as a result of a non-accidental violence produced by a parent or a guardian. In addition to physical injury, there may be non-accidental deprivation of nutrition, care and affection. Age usually less than 3 years but occur at any age. Sex common in male child 55 to 63%. Position in family common in one child of a family, commonly eldest or youngest of unwanted result of pregnancy before marriage. Failure of contraception or an illegitimate child. Parental issues, young uneducated parents age 20 to 30 years from low social class living in isolated family. History of family disharmony, long-standing emotional problems or financial problems. History of unhappy childhood experience and suffer guilt amnesia. Father's criminal record or unemployed, socially unstable. Mothers lower IQ with multiple social and psychiatric problems and a confused and violent home background. Other often pregnant or in a premenstrual period at the time of battering. History often no obvious relationship between nature of injury and the explanation offered for them, which is often changed on several times of repetition. Every time child is taken to a different doctor. Treatment always unexplained. Delay between injury and treatment. Precipitating factors. Actions of a child like crying, refusal to be quiet, persistent soiling of napkin, etc. Soft tissue injuries are most common, mostly bruises and abrasions. Lacerations are less common. Injuries of varying ages due to repeated abuse. Multiple bruises of various age all over body from rough handling or beating or kicking or throwing are common. Bruises common around elbow and knees due to gripping of child so as to shake or pull him or hurl him into court or against furniture. Injuries seen over head, neck, face. Slap markers, lash mark, knuckle punches, pinch mark, butterfly shaped bruise with one wing caused by thumb other than the other. Bald patches on scalp due to pulling out hair. Traumatic alopecia may be seen. Laceration of inner mucus of upper lip, often in center, characteristic lesion. Bite mark over cheeks, shoulder, chest, abdomen, arms, legs and buttocks. Small circular pitted burn indicated deliberate stubbing of cigarette end on skin. Scars are also common. Caffey syndrome, infantile whiplash syndrome, shaken baby syndrome characterized by Caffey, caused due to vigorous shaking of child by holding him in air. Injuries, triad of injuries include encephalopathy, retinal hemorrhages, subdural hemorrhages most consistent, bruises in areas where a child is held, subgaleal hematoma due to rigorous pulling on skull, characteristic injury, habitual and prolonged shaking lead to permanent brain damage. Skeletal injury. Bony injuries include transverse fracture, impacted fracture, spiral fractures, metaphyseal chip fractures, subperiosteal hematoma, epiphyseal separation and periosteal shearing due to violent pulling or twisting of limbs, fracture of long bones due to compression, bending or direct blows, anterior-posterior compression of chest causes fracture of ribs at costochondral junction and side-to-side squeezing causes fracture along posterior angle of ribs. Multiple deformities of long bones and rib cage of body due to multiple healed fractures and callus formation. Fracture ribs healed by callus formation in 1 to 2 weeks, giving characteristic appearance of a knob fracture. On X-ray, string of beads appearance are seen in paravertebral gutter. Visceral injury. Subdural hemorrhage, most common cause 40%. Crushing or compressing force on abdomen produces bursting injuries of liver, spleen, perforation of distended hollow organs like stomach, intestine or urinary bladder. This one is grip mark with adult hand, butterfly shaped pinch mark, bite mark, black eye slap mark, bruises caused by canes and belt, burns from an iron, cigarette burns on the sole, skeleton and visceral injury. Medico-legal importance. Child abuse is a serious problem in India, and attitude of society towards the same is the reason for prevalence of child abuse. Lack of legalization further aggravate the situation. However, India has recently enacted Prevention of Child Against Sexual Offences (POCSO) 2012, which is step in the right direction. Thank you.